So a lot of you I know have the Aetna CVS individual health plan, right? And this is big news, so you're probably going to want to stick around for this. So there's about 1 million people covered under the ACA program that currently, as of 2025, Aetna is offering, right? But that's going away at the end of this year. Now, this is big news. And I think this could be something that spreads a lot further across the health insurance industry. But let's talk about Aetna CVS right now for a minute. Over 1 million Americans who are covered by Aetna CVS Health are going to lose their health care at the end of 2025. Now, this has been a pretty good health care plan for a lot of people. It's a very good health insurance program. A lot of people benefit from this thing. But Aetna CVS said that they've had a shift in priorities and they're losing money. This ACA program is just bleeding Aetna CVS Health a lot of money. And at the end of 2025, they're going to cut it. Now, I want to know what you think about this. So, here's what we know about this Aetna CVS Health cutting coverage to 1 million Americans at the end of 2025. We know that Aetna CVS Health has been losing money in their ACA program. And a lot of other health insurers are losing a lot of money under the Affordable Care Act, right? So Aetna CVS set aside something like $448 million in reserves to cover these losses. So they were prepared for these losses, but that money's running out. Overall, Aetna insures somewhere between 27 and 36 million Americans. ACA plans represent a very small portion of that, right? So that's only about 1 million people have it. And it's only available in 17 states across the country. So, in hindsight, from a business perspective, this loss is purely financial. It's purely financial for Aetna. This is a relatively small portion of their market share, a very small portion. And I get it. Sometimes in a system like this, right? In what we have, some people are going to get left behind. If you're one of these 1 million or so Aetna CVS Health customers who have this plan, you're going to get left behind. It's just that simple. They've chosen to protect the larger group. You can't blame them for that. Some people are going to suffer from that. And they're going to have to go to much more expensive and much less beneficial plans to get their health insurance. So these ACA plans, right? They're just not very competitive. They're not very profitable for insurance companies. The margin on these things are very, very, very slim. So they're not making a ton of money on these things. And they kind of view these things as a financial drag to them, right? So these insurance companies are going to start cutting these programs, which I think in some ways that's what the conservative side of things really wants, is for people to be taken off of these things because they want a free market. And you can't argue with that. I mean, America is a free market. We're not socialist. Now, here's something that a lot of people forget, because the federal ACA subsidies that are out there right now and the tax credits that are out there right now are set to expire at the end of 2025 unless Congress somehow intervenes. This Congress should have no clue what they're going to do. I mean, this Congress is pretty dysfunctional. So it's not likely that they're going to intervene. I don't see it happening. If they do, it's going to be some watered down conference committee version of this thing, which is going to be good for nobody. Now, additionally, the one big beautiful bill, right? The one big beautiful bill, whatever it's called, it did not extend these ACA credits. It didn't do anything for them. Some analysts say that this rollback is directly in response to the big beautiful bill not doing that, right? So this is a serious issue for a lot of Americans, and I think we're already starting to see this kind of unfold here, especially for the economically challenged, the poor. So the bottom line to this is that the ACA segment of the health insurance industry is hurting. It's losing hundreds of millions of dollars annually. It's not profitable for insurance companies. And we're seeing this across the board. CVS says that they want to invest in more stable, more economically conducive vehicles for the company. They're a private company. They can do whatever they want. They're allowed to. They want to invest in some stable areas, as they call it. Look, they have the right to do it. It's really that simple. The biggest deal here is with the ACA and with the one big beautiful bill, right? Because the future of these tax subsidies that have been funding this thing expire at the end of 2025, and they look very uncertain right now. The future of this looks completely uncertain because of all of these converging factors that we're seeing, the expirations, the one big beautiful bill, all this stuff, right? CVS has just finally said, you know what? Look, continuing the ACA marketplace program is just unsustainable. So we're going to stop it after December 31st, 2025. So members are going to have to choose something else during the fall of 2025, the upcoming few months, right? When open enrollment comes around. And that's going to start 2026 plans. Those plans are likely going to be much more expensive and give you many, many, many less benefits. We see that with companies like Blue Cross Blue Shield. Much more expensive, far less benefits. In the end, this is just one of those things where the poor are going to suffer. Thank you very much for watching. I'm Matt Pierce. Draw your own conclusions. Be sure to like, subscribe, comment, and share.